Assalamualaikum. My name is Putri Hadina Hanani binti Rosali. Here I want to explain about what is diabetes mellitus. For information, diabetes mellitus is a chronic metabolic disorder characterized by hyperglycemia or elevated blood glucose levels, resulting from defects in insulin secretion, insulin action, or both. Other than that, this high blood sugar level results from either insufficient production of insulin by the pancreas or the body's inability to effectively use the insulin it produces. Insulin is a hormone that regulates blood glucose levels by facilitating the uptake of glucose into cells from energy production or storage. Without proper control, prolonged hyperglycemia can lead to the serious complications including damage to the heart, kidneys, eyes, and nerves. There are several types of diabetes mellitus such as type 1 and type 2 of diabetes mellitus. Code E10 signified by type 1 diabetes mellitus, a condition defined by the body's inability to manufacture insulin and the most commonly diagnosed in the children and young people. It refers to the juvenile diabetes. However, Code E11 indicates by type 2 diabetes mellitus, a condition in which the body develops resistance to insulin or produces insufficient insulin. Type 2 diabetes mellitus, more commonly in adults, may be managed initially with lifestyle change and medication. Example case study where is Encik Rashid, 16 years old male, represent for a routine checkup. He has 15 years history of type 2 diabetes mellitus, currently managed with metformin and lifestyle modifications. Plus, if the types of diabetes mellitus is not documented in the medical record, the code will be E11 type 2 diabetes mellitus. For diabetes mellitus and the use of insulins, oral hypoglycemics, and the injectable non-insulin drugs. When a patient is diagnosed with type 2 diabetes mellitus without specifying complications, code E11 type 2 should be assigned. But if the patient is treated with diabetes mellitus with specifying complication, additional code will be assigned from category code Z79, long-term current use of insulin.
Hi, my name is Nurina Suha binti Karulijal. So now I will continue with the first case study. Mary, a 52 years old female, are diagnosed with type 2 diabetes mellitus for 8 years. She has been struggling to control her blood sugar with metformin alone. Recent tests show her HbA1c remains high, and she experienced occasional spikes after meals. Based on this case study, the following ICD-10 codes are assigned. The first code is E11.65, type 2 diabetes mellitus with hyperglycemia. This code indicates Mary has type 2 diabetes mellitus and elevated blood sugar as described in the case study, followed by additional code Z79.4, long-term current use of insulin. This code signifies that Mary diabetes management includes long-term use of insulin. And the other additional code is Z79.84. Long-term current use of oral hypoglycemic drugs. This code refers to metformin intake that is used to control Mary's blood sugar.
Next case study 2, Hannah, a 60-year-old female with type 2 diabetes mellitus for 12 years, has been on a long-term insulin therapy for the past 4 years and using a GLP-1 receptor agonist for 18 months to control her blood sugar levels. The appropriate ICD-10 codes for her treatment are E11.9, type 2 diabetes mellitus without complications. Next, Z79.4, long-term current use of insulin. And the last one is Z79.85, long-term current use of injectable non-insulin antidiabetic drugs. These codes were chosen based on her current treatment regimen. First code, E11.9. This code indicates that Hannah has type 2 diabetes mellitus without complications. It is the principal diagnosis that represents her underlying condition. Next code, Z79.4. This code indicates that Hannah is on long-term current use of insulin. She has been administering daily insulin injections for the past 4 years to manage her blood glucose levels effectively. The prolonged and ongoing use of insulin qualifies her for this specific code. Last code is Z79.85. This code indicates that the long-term current use of injectable non-insulin anti-diabetic drugs. Hannah has been using a GLP-1 receptor agonist on injectable non-insulin medication for the past 18 months. This medication helps control her blood sugar levels in addition to her insulin therapy. The extended use of this injectable medication justifies the assignment of these codes. The choice of these codes accurately reflects Hannah's treatment for diabetes, providing a clear picture of her long-term medication use.
John Doe, a 50-year-old male with a 10-year history of type 2 diabetes mellitus, presents for his routine follow-up appointment. His diabetes management includes both oral hypoglycemic drugs and an injectable non-insulin anti-diabetic drugs. Based on the cases above, the principal diagnosis is E11.9, type 2 diabetes mellitus without complication, followed by Z79.84, long-term current use of oral hypoglycemic drugs, and Z79.85, long-term current use of injectable non-insulin anti-diabetic drugs. These codes are assigned because John is a long-term regimen that includes both oral hypoglycemic drugs and an injectable non-insulin anti-diabetic drug. The inclusion of these codes in his medical records ensure proper documentation of his current treatment plan and supports continuity of care. E11.9 stands for type 2 diabetes mellitus without complications. This means that John has type 2 diabetes but is not experiencing other health problems that can be caused by diabetes, such as kidney disease, nerve damage, or eye problems. Then, Z79.84, long-term current use of oral hypoglycemic drugs. This code is used to indicate that the patient is on a long-term treatment regimen involving oral medication to manage their diabetes. In John's case, metformin and glimepiride are the oral hypoglycemic agents being used. And the last code is Z79.85, long-term current use of injectable non-insulin anti-diabetic drugs. This code signifies that the patient is using injectable medication other than insulin for diabetes management on a long-term basis. For John, exenatide is the injectable non-insulin anti-diabetic drug being utilized. Code Z79.4 should not be assigned if insulin is given temporarily to bring a type 2 patient blood sugar under control during an encounter.
Assigning ICD-10 code E11 for type 2 diabetes mellitus as well as Z79 for long-term insulin use ensure that treatment methods are accurately documented. This method represents beginning with oral hypoglycemics and progressing to insulin as needed. This coding method ensures that treatment complexity is accurately represented, assisting healthcare practitioners in adjusting therapy to reduce complications and maintain appropriate blood glucose levels in type 2 diabetes mellitus.